Hello, welcome to another episode of Your Health, Your Life. Today we're going to be talking about the complications of benign prostate hyperplasia, something that we simply called prostate enlargement in our previous video. For all our viewers that are out there supporting us and, always there liking on our posts, commenting on our posts and actively engaging us, we're very grateful for you and we pray that you continue to do so. So let's just get straight right into it. Complications of prostate enlargement. So as far as complications of an enlarged prostate are concerned, I think there are two main things that we have to talk about. So we're going to talk about what we call urine retention, and then we're also going to talk about what we may refer to as kidney damage. We're also going to touch lightly on urinary tract infections that people with prostate disease can present with. So, urine retention, what is it? We described initially in the first video that we did, that the prostate enlarges, and when it does so, it encroaches or it grows around the urethra, which significantly reduces the flow of urine. How so? Because it obstructs the urethra. And the implication is that people are going to have symptoms that range from increased frequency of urination or the sensation of feeling as if they cannot completely empty their bladder. You may want to refer to the first video to get the full spectrum of symptoms that were discussed and how essentially they can present like. So as far as urine retention is concerned, what happens? Once you have an obstruction in the urethra itself, you're going to have urine accumulating within the bladder. The bladder is going to stretch. As it stretches, the bladder cannot contract and relax or become small again because there's an obstruction and urine is trapped within the bladder. This excessive stretch is going to result in severe lower abdominal pain. Some patients are also going to present with what feels like a mass or something growing in the lower part of their abdomen. And all those are signs that can be consistent with the presentation of what we call acute urinary retention. We call it acute because it happens in a short period of time, usually 24 to 48 hours. You can also have what is referred to as chronic urinary retention. The word chronic simply means something that happens over a prolonged period of time or something that lasts over a long period of time. And this essentially is when you get urine again accumulating within the bladder and staying in the bladder. The bladder gradually distends, it gradually stretches, but because most of these patients are going to present with some degree of passing urine through the urethra because there's only partial obstruction of the urethra itself. So these are the key differences. There's going to be partial obstruction of the urethra. So they're able to pass some amounts of urine, but not enough. So eventually the bladder fills up and stretches to full capacity. Because this happens gradually over a prolonged period of time, the pain may not be as much as those that have acute urinary retention. Generally, people with chronic urinary retention are going to have an even more distended bladder that can be felt in the lower part of the abdomen. For the medical students that are listening out there, or for those that are already in the health profession, you're going to find that people that have chronic urinary retention are going to present with an enlarged bladder, usually extending all the way to the level of the umbilicus, while those that are in acute retention, generally it's below the level of the umbilicus. So what are the complications that we're looking at? We referred to kidney damage. How does it happen? Well, because urine is accumulating in the bladder, you get a backflow of urine and it goes all the way to the kidneys. If that happens, the ability of the kidneys to filter urine, the abilities of the urine to remove the toxins is significantly affected. And this is going to result in kidney impairment. So you're going to have accumulation of poisons or toxins that accumulate in the body, and that may bring about a host set of complications that may be life-threatening. So that's how the prostate enlarging can actually bring about damage to your kidney. It's not that there's something wrong with your kidney, but because there's a backflow. When urine is filtered, it can't go anywhere. So this significantly affects the filtration ability of the kidney, and the water engorges in the kidneys, making them big. Urinary tract infections. Because of the constant presence of urine within the bladder. Remember, these patients cannot empty their bladders completely. They always have what we call residue urine, meaning the urine is just there stagnant, staying in the bladder. That acts as a reservoir of infection within the bladder itself and makes them more at risk of developing urinary tract infections. And some of these may be resistant to most of the antibiotics that we use. So that's something for us to keep in mind. So these patients may present with low abdominal pain, increased frequency, they may present with a fever, they may need antibiotics if there's evidence of infection. So those are just some of the things that we may want to look and to consider and think of if someone has an enlarged prostate. How do you prevent these from happening? Well, you stick to your current regimen. If your doctor has prescribed medication, stick to them. If your doctor has prescribed surgery, then have the surgery if you can. That is going to significantly improve your symptoms and is going to significantly improve or reduce the possibilities of you having the complications that we have discussed above. Urinary retention, generally when you go in the hospital, they're going to insert a catheter through a urethra to bypass that obstruction. A catheter is simply a nice silicone tube that we push through the urethra. It will go all the way up into your bladder, bypassing the obstruction, and that is going to give you relief. You're going to have, they're going to empty your bladder as well. Some patients may need the catheter to stay with them for some time to give time for the drugs to actually have an effect on their prostate or until they have surgery, whatever your doctor sees fit. So always remember to consult your doctor and always remember to go to the hospital when you have any of the problems that we have highlighted in this video. So for comments, likes, and anything, feel free to do that. Please follow our channel on YouTube, and please invite as many people as you can so that we can even reach more people and educate them about these things that affect all of us. From your health, your life, have a lovely day.